Hi, my name's Rayel Martin, and I'm a therapeutic recreation student. This semester, I was fortunate enough to get my placement at Regency Manor in Central Butte, Saskatchewan. Regency Manor is a 27-bed long-term care home. This home has nursing and continuing care assistance 24/7. We are also fortunate to have primary health care clinic attached to the building for care from a nurse practitioner Monday through Thursday. During my placement, I was able to spend time assessing residents' abilities, practicing documentation, creating resident-centered care plans, and leading activity programming. I was able to take initiative and create programs in the evenings and run them on my own. I also created activity calendars and was able to be a part of many virtual meeting groups, and I was introduced to many other professionals within the field across our province. Regency Manor uses the Activity Pro program to track all resident activity. This allows us to see what residents are attending activities, how involved they are in the program, have visitors, or getting one-to-ones with staff. The program allows you to create resident profiles, update their likes and dislikes, know their history, create monthly calendars, and has the feature to do assessments and create care plans. My special project was to compare Activity Pro assessment and care plans to the Measurable Assessment in Recreation for Resident-Centered Care, otherwise known as the MARRCC. This is the assessment that the Manor has previously used, and I was able to use both assessments over my semester and make comparisons to determine what would be more beneficial for the Manor to use. So here's a comparison of the two assessments. They do have some things in common and some things that are different. Both assess the ability and interests of long-term care residents. They focus on the domains of health, and they're fairly easy to access. The differences between the two is based on how they are scored, so whether that's manual or automatic, and who can administer the assessment. Activity Pro can be used by anybody, no matter if they have training or not. This project was completed over about 10 weeks. Each assessment took different amounts of time based on the resident's ability. Each time an assessment was completed, it counted for my NCTRC hours, as well as just working towards my special project, so I got to develop two things at once. After completing the assessments and looking at the results, they are very similar, so I would suggest that if there is no CTRS on staff, which is normal for the Manor, to use Activity Pro, as it can be interpreted by anybody, and if there is a CTRS or student here, then using the MARRCC assessment alongside Activity Pro would be very beneficial. So just some of the skills that I developed from doing my special project would be administering different assessments and documenting from both of them. Next time I would administer more assessments and use different assessment tools rather than just the two that I had used. Overall, within Regency Manor, I believe that the use of Activity Pro will be beneficial to have as a tool that can be used by all staff working and can allow coordinators to have an idea of the residents' abilities within each domain. Moving forward, I will be able to take the knowledge from the assessment and program into other careers. I believe my special project has positively impacted Regency Manor and hopefully will continue to make a difference into the future.